Hello, my name is Jenna. This is my Module 5 assignment for Adult Health. For this assignment, we were to create a label diagram of the eye and depict 3 common disease processes of the eye in the adult population and 3 common disease processes of the eye in the geriatric population. So first we will talk about the eye diagram and its main structures and functions. So the sclera function as the supporting wall of the eyeball. It helps maintain the eyeball shape and protects it from injury. The lens function is to transmit light, focusing it on the retina. The pupil is an opening through which light can enter the eye. The iris adjusts the size of the pupil to control the amount of light that enters the eye. The cornea's main function is to refract or bend light. The ciliary body and muscle produces the fluid in the eye called Glase's humor, and the muscle changes the shape of the lens when your eyes focus on a near object. The conjunctiva provides protection and lubrication of the eye by the production of mucus and tears. The optic nerve relays messages from your eyes to your brain to create visual images. The macula is responsible for central vision, most of our color vision, and the fine detail of what we see. The retinal blood vessels provide blood to the inner retinal neurons. The vitreous body maintains the round shape of the eye. The retina has photoreceptor cells that process different light signals, such as color variations, and uses the optic nerve to transmit these signals to the brain. In the retina, there are cones, which are responsible for sharp, detailed central vision and color vision, and are clustered mainly in the macula. Rods are responsible for night and peripheral vision. Three common disease processes of the eye in the adult population include cataracts, retinal detachment, tears, and dry eyes. So cataracts are the clouding of the lens in the eye, which is normally clear. So the area affected is the lens. Clinical manifestations are blurred vision, inability to see in dim light, seeing halos around lights, or vision loss. It's typically diagnosed by a slit lamp that allows the doctor to see your lens. From there, they're able to see if the lens has a cloudy look. The treatment, so only cataract surgery can cure cataracts. This would involve the removal of the lens of the eye and replacing it with an artificial lens. Nursing management includes structuring the environment with conductive lighting, reducing fall hazards, encouraging the patient to verbalize their fears and anxiety about visual loss or impending surgery, and assisting the patient with actions of daily living if needed. So for retinal detachment or tears, that is when the retina pulls away from supportive tissue. So the areas affected of the eye include the retina. Signs and symptoms could include appearance of many bits of debris, flashes of light, tunnel vision, or vision loss. So it's diagnosed with a bright light instrument and special lens to examine the back of the eye, including the retina, to look for any tears or rips. The treatment includes surgical interventions like laser therapy, which welds the retina back to the tissue, or freezing, which causes a scar that helps secure the retina to the eye wall. Nursing management includes preparing the patient for surgery, encouraging the patient not to cough or sneeze, or to perform any other strain-inducing activities, administering prescribed medications for pain, and teaching the patient to recognize and immediately report any symptoms that may indicate recurring detachment. With dry eyes, that is a condition that occurs when your tears aren't able to produce adequate lubrication for the eyes. So the area infected is the conjunctiva. Signs and symptoms include dry eyes, eye discomfort, redness of the eyes. It's typically diagnosed with the Schirmer test, so it measures your tear production. Treatment usually includes prescribed or non-prescribed lubricating eye drops. The nursing management includes teaching the patient how to apply eye drops, educating the patient on other ways to alleviate dry eyes. This could include like using a warm compress or humidifier. Three common disease processes of the eye in the geriatric population include presbyopia, glaucoma, and age-related macular degeneration. So presbyopia is the gradual loss of the eye's ability to focus on nearby objects. The areas infected includes the lens, it becomes hard. Signs and symptoms include having to move reading material closer to the eyes to be able to see, blurred vision at normal distance, and eye strain. It's typically diagnosed with a refraction assessment. Treatment includes non-prescription or prescription eyeglasses or contact lens. So glaucoma is a group of eye conditions that cause blindness. The area affected of the eye is the optic nerve. Signs and symptoms, there's typically no symptoms other than slowly losing your vision. It's typically diagnosed with the doctor using eye drops to widen or dilate the pupils and examining the eyes. There they can check the optic nerve for any signs of glaucoma. Treatment includes glaucoma medications, eye drops, beta blockers, or sometimes even laser surgery. With nursing management, the nurse would want to allow the patient to express their feelings of their vision loss. They would want to demonstrate the administration of eye drops and educate the patient on the importance of compliance with prescribed drug therapy. And then age-related macular degeneration is a progressive eye disease where the central portion of the retina gradually deteriorates. So the affected area is the retina. Signs and symptoms include blurry, fuzzy vision, difficulty recognizing familiar faces, and loss of central vision. It's usually diagnosed with the Amsler grid test, checks for defects in the central vision. Treatment usually includes the injection of medication called anti-VEGF agents. Nursing management would be to assess the patient's ability to see and perform activities, provide lighting that avoids glare on surfaces and reading materials, and then providing large print objects and visual aids for teaching.